Cerian. I am a clinical neuropsychologist and a clinical psychologist, which just means that I'm a clinical psychologist who's done even more training to become a clinical neuropsychologist, and I work on the doctorate in clinical psychology at the University of Liverpool. So today I thought I'd go over what clinical psychology is. As over the years, I think it's chopped and changed and looks quite different from how it looked 10, 15, 20 years ago. We'll talk a little bit about the course, what it is, what it looks like, what a typical day for our trainees are, and then move on to what we look for in our candidates and how many applications we get, how competitive it is, what a strong candidate looks like, and what you can do now. So I hope that's what everyone was expecting. I haven't gone into too much around kind of my journey or anything, but obviously would be happy to answer any of that at the end. So what is clinical psychology? It's changed, I would say. So I admittedly I come from a family of psychologists, and I've been exposed to clinical psychology for a long time, and it's chopped and changed over the years, and it no longer is the kind of one-to-one therapy role that it used to be. I can't get rid of this. Yes, I can. So I would never say that clinical psychologists are therapists. I think if therapy is your bag, if that's what you like, and you want to work with people, do lots and lots of therapy, there's much better routes to do that, which I think you've had a few presentations about those routes already. And just on time, my dog walker's here. I'm just going to shimmy her out the room. One sec. Jess, come out. Come on, come on, come on. Apologies. So yeah, I think you've had some really good talks already about better ways to become a therapist. But what clinical psychology does now is a really diverse profession. We work in lots of different specialist areas. I work in neuropsychology, which is a very niche area. We also work into forensic settings, just like the previous speaker was speaking about. Child adolescent services, mental health, lots and lots of different ones that I will not do justice to if I try and explain them, because I am very, very pigeonholed in neuropsychology. What do we do now? We shape services and policy. It's much more of a leadership role than I think it was 20 years ago. We train and supervise teams. We deliver group and community interventions, and we're also leaders in research and innovation. We're very much scientist practitioners. We're constantly trying to improve our knowledge of human experience and our interventions for how we can improve that, not just on a one-to-one basis, but within systems, within local areas, and nationally and internationally for some people, when they really are leaders in their field. What is a DCLIN? The Doctorate in Clinical Psychology is the entry qualification for the profession of clinical psychology. It's a 3-year professional doctorate. Within that, you have academic assignments, clinical placements, research dissertation, and our clinical psychologists are also students, and they are salaried members of staff employed by the NHS Trust. So every university will be linked to a sponsoring NHS Trust. At the University of Liverpool, we are linked to Merseycare. So all of our trainees have contracts with Merseycare, and they are salaried. So they're on a band 6, which I think is about £38,000 as the starting salary, which in the 3rd year goes up to £40,000. So you're paid to do a doctorate, essentially, which is why I think it's so appealing to many applicants. So if we have a look at each of these sections, what are the academic assignments that you'll be asked to do throughout your doctorate? You have clinical case reports, both written and oral. So this will be, you'll write up a case that you've done on clinical placement. When you're supervised by a clinical psychologist, you'll write up your work, evidence your work, and then it will be appraised by a member of the internal team and an external moderator. The oral one is meant to simulate a presentation you might do in an MDT, when you have to feed back to a team about a case that you're working with, how it's going, what you've done, and critically appraise some of the work, and then respond to questions. Service valuations and audits, again, with our promoting kind of service development. We're constantly appraising the services we have to see, are they meeting the needs of those that we serve? So developing skills in those areas in terms of how do we do that? How do we recognise gaps in our services? So we'll train our trainees in those areas. We do a lot of observed clinical observations, and we've just introduced an OSCE, which is what the medical school do, and the dentistry school. So we've just introduced one of these where it will be a risk assessment, and our trainees will do a risk assessment observed in exam conditions and be marked on how appropriate and in depth that risk assessment was. There's lots and lots of groups of individual presentations. There's 40 in every cohort, so you'll be in small groups a lot, working with your peers, and they all have rich and diverse backgrounds, so you'll learn a lot from peers. We'll talk about that a little bit later. And we also have simulated clinical discussions. So again, we do a lot of consultation, a lot of teamwork in clinical practice. So our training tries to reflect that, and that we will simulate some of those NDT discussions and then provide feedback and grading accordingly. So the clinical assessments, our course, I can only speak to our course. I know some of the other local courses have changed this a little bit and now do 3 longer placements. But in the University of Liverpool, we still have 6-month clinical placements at local NHS partners. It's not just Merseycare. We work with all of our local partners. And we have 4 core placements in adult mental health, learning disability, older adults, neuropsychology or health, and child. So they form the 4 core components with our core competencies that underpin all of what we do. And then when trainees enter their 3rd year, this is an opportunity for trainees to seek out their own special interest areas and seek out a placement that is in line with that. And this is where trainees enter much more of a niche environment where those fundamental skills that they've learned throughout those 4 core placements can be applied to a much more specialist setting. That might be kind of tertiary neuroscience centres, it may be forensic settings, it may be we've got someone with freedom for torture at the minute, so entering also third sector organisations and our NHS partners. Each placement will be appraised by the clinical psychologist supervising the training, according to kind of predefined criteria. You'll know what it is when you enter placement, but also our trainees will also appraise the supervision and the clinical placements as well from a trainee perspective to ensure that every placement is providing that quality learning opportunity and environment for trainees to develop those competencies that underpin our profession. The research dissertation, the thesis, admittedly, I can't remember any of my undergraduate degrees, so I can't say how different or similar it is, but what it consists of is 2 parts. It's a systematic review and an empirical paper, both which should be written up as if they were going to be published, and we do encourage our trainees to publish them. A 3rd chapter may be required if there isn't clear connection between the systematic review topic and the empirical paper. There will be a 3rd bridging section where the trainee needs to provide a short chapter explaining why there is a link between these 2 chapters. How you decide them. So this is a big question that comes up in how do trainees get their research dissertation areas or projects. Again, lots of universities do this differently. Some universities take a much more prescriptive approach. Others, it's completely driven by trainees and they have to go and find their area, then find someone to supervise, then develop the question. We probably fall somewhere in the middle, I would say. We're a bit of a hybrid. So there is a Padlet with kind of project ideas and research questions within there, driven by research supervisors within the university. But equally, we really encourage trainees, if there is a passion of theirs and there's an area that they're really interested in, they want to work in, we really try to foster that. So we want to promote trainees to pursue the research areas that they are passionate about rather than just having to pick a project just to get through the course. So we'll always, where possible, try and supervise areas of interest that our trainees enter the course with. You always have to have an internal supervisor, really just to protect the trainees in terms of having to meet those university milestones to get their qualification. But we also encourage trainees to work with external field supervisors. So these are clinicians usually working in practice. Teaching, and I've got some animations apparently. It's exciting. So how do we teach? Loads of different ways. Teaching days can look quite didactic. They might look more like the lectures that you do now in terms of there'll be a presentation. You'll sit and make notes and maybe some small discussions within that. All the way down to we have much more experiential teaching sessions where kind of experts in the area will come in and they will run an experiential session in mindfulness or some chair work in ACT, so in different therapeutic skills, and trainees can experience that rather than just being told this is the evidence for it, this is what it is. You really get to immerse yourself in that therapeutic technique. We do a lot of EBLs, problem-based learning, inquiry-based learning, and then it will always end with a presentation. We do lots and lots of presentations, lots and lots of role plays. Again, it's trying to mimic what will happen in clinical practice. So in clinical practice, we do a lot of presentations, we do a lot of consultation, we do a lot of working with teams, a lot of obviously working with individuals. So there's lots of role plays and lots of things that I think feel quite exposing in the beginning, but by the end, trainees feel really used to them. It's like second nature. And that's also part of the process is getting a bit more comfortable with some of these more exposing ways of learning and being appraised. Also have workshop style sessions. We do a lot of this in the CBT pathway, where they'll have, again, experts in the area will come in and do more workshop style learning. So lots and lots of different ways of learning. Two teaching days should never really look the same. So try and keep it interesting, but also reflecting what we do in clinical practice. So sometimes there will be areas that need a more didactic approach, and sometimes it will be more experiential. So who do we get to teach? We have a massive internal staff team now. This is with the recent increase in numbers. So between 2020 and 2022, the number of places across the country went up by about 40%. So we've expanded in accordance with that. So a lot of our teaching now is done by internal members of staff, which is quite good because you get to develop more of a rapport with the team, and we feel a much more integrated program. But we also do our best to try and get other staff in the wider university. We're really rich with expertise in various areas, and we try and pull in as many different people as we can to make sure that our teaching is kind of really current and provided by recognised experts in that area. We also get our NHS colleagues, so again, experts working in those clinical areas with that on the shop floor experience, to come in and teach in their area. We also get experts by experience. We have an amazing Lexi group, Liverpool Experts by Experience, which was set up by the University of Liverpool. They now teach on a number of different courses across the country, but they are integrated within our team and provide lots of our teaching, and that usually gets the best feedback from our trainees. We also have third sector colleagues and guest lecturers from other universities. So we try and keep it really varied and make sure that the teaching is really current, is by people who are working within this area day in, day out, and will be able to answer questions according to the current evidence and current practice and current landscape of the profession. So who do you have to help you on this journey? So all of our DCLIN staff serve as personal tutors or academic advisors. So as soon as our trainees start the course, they'll be assigned to a staff member. They'll also get a buddy or a peer mentor, and also can opt in to a mentor scheme where you can be buddied up with a practicing clinician in the area in which you want to work. You can provide a bit of a professional mentor if you don't have one. You also have PPD groups, so personal professional development groups. These are groups of across cohorts, so year 1, year 2, and year 3. They form about a group of about 20, I think, and I think it's every month, every other month. There's a dedicated session for that peer supervision and peer personal and professional development. We also have an amazing library. Our librarians are the oracle of all things searches and evidence. You get really detailed feedback on all academic work. There's opportunity for debrief on every assignment that you do with your academic advisors. We have a broader things within the university, like the disability support service, student support. There's additional courses you can go and do. Some people come back to academia after having had a different career and then returning to education, and they may feel a little bit rusty with their academic writing. So again, the university provide lots of support and courses with that. So any area that maybe people are feeling a little bit more anxious about, there's usually a pre-proven route and course that people can do to make them feel more comfortable and confident in that area. So we're a little bit spoilt with our broader university systems and pathways, as I'm sure JMU are as well. So what this looks like for our trainees: year one, they're in teaching 2 days a week. They are in clinical placement 2.5 days a week. And then they have half a day study time. So all of the assignments in year one can be done in half a day. So half a day a week. You do hear a lot of horror stories of people saying, like, you never get your weekends, you never get your evenings. It is a very demanding course. I'm not going to sit here and say it's not. It can always be done within a 9 to 5. There are people who say it can. There are people who say it can't. It's all about how you use your time. But it is a demanding course, and it is something to think really long and hard about if this is something that you want to do, because it isn't for the faint-hearted. Year two, you start to get a little bit more time here. So you have 1 day teaching, or 1 day's teaching, according to my typo. 2.5 days on clinical placement, half a day study, and then you get 1 day a week for research activities. So by this point in year two, we'd expect most research projects to be up and running, and trainees need a bit more time for the recruitment, for the running of the study. So you get 1 day a week for that. And then in year three, it looks quite similar, but in March, the teaching finishes, and that 1 day teaching converts into another day research time. So this is at the point where we'd expect most trainees to be that final push of recruitment, and then all the analysis and the write-up. So it's the bulk of that research project work. So you get a little bit more time, independent study for the research time. So applying for the DCLIN. If you're still interested after that, all of our applications go through Clearinghouse. At Liverpool, we receive over 900 applications for 40 places each year. So this is just over 22 applications per place. So it is really, really competitive. Even with those increased numbers, it's still a really competitive course. And this is similar across the board, across the country, in terms of, if you look at the numbers of applicants to places in all universities, it usually is around 20, 25, even 30 to 1. Our applications at Liverpool, I can't speak about other courses. Every course has their own criteria. But here at Liverpool, all of our applications are scored according to academic, clinical, and research experience, as well as kind of interpersonal values and how they mesh with our ethos at the University of Liverpool DCLIN. So typical candidates, this is the question I always get asked. So I try and include a slide or a section about what would a typical candidate be like. I've got this, would that be enough? And it's a really, really difficult question, because we are such a diverse profession, and our applicants reflect that. So it may be, your typical or most common candidate may be done a bachelor's degree, done a master's degree, and then has about 3 to 5 years clinical experience supervised by a clinical psychologist. The key bit there is supervised by a clinical psychologist. The reason being is that there's a huge investment in our training, and all of our trainees have had a huge investment from NHS England or whoever's taking that forward when they disband. So we need to be sure that our trainees are fully aware of what this career is, what it means to be a clinical psychologist, and how their career is going to look afterwards. So we want to know that those that we train are going to do this as a lifelong profession. And being supervised by a clinical psychologist gives a bit of confidence that they've had that exposure and that experience. Typically, most candidates have a 2-1 or a first. Although we do accept a 2-2, as we fully appreciate that between the ages of 18 and 21, a lot can happen. And there can be competing demands and contextual factors. But what we do usually look for then is some evidence that the applicant can perform at a higher academic level. So we'd usually look for things like a master's or other qualifications that would, again, it would make us more confident that the applicant is going to be able to manage the demands of a doctorate level academic environment. So that would be my advice for anyone currently studying. Publications are not necessary, but helpful. Clinical experience is usually really helpful. Again, if I was to talk more broadly about what a typical applicant would look like, we have kind of some people have had a different career. We get social workers, nurses, CBT therapists who have maybe had a change of career and taken a step back and gone and saw clinical experience in a clinical psychology environment. So maybe they've been out of education for a long time and then returning right the way through to the other end of the spectrum where someone's done a bachelor's, master's, PhD, has a year of clinical experience and scores really strongly on the academic side. So it's a huge array. And I think we really welcome this as a training course as well, because what we find is that in our cohorts of trainee clinical psychologists, people learn from each other. So as well as learning from the placements, the teaching, you're learning from your peers as well. So it's really nice to have that diverse group of trainees. And also it fits with what we're trying to achieve as a profession, which is having that depth and breadth of knowledge and skills. So what can you do now? I guess my words of advice would be focus on your undergraduate and master's degree. Do really well in that. It's always going to help. Meet and chat with others who've applied or who are on training, attending this event is probably really helpful. Engage with local services for experience where possible. I know it might not be possible for everyone to do this, but if you are in a position where you can get involved with some local services, whether on a voluntary or part-time basis, that would probably be helpful. I think our previous speaker was talking about how competitive the assistant psychology posts are. And yes, I would echo that. We get like over 100 applicants at the Walton Centre for kind of one position. So any foot in the door is usually helpful. And again, to echo what's been said before, try not to rush. This is part of your journey. Don't skip it, because if you skip it and you get to the point down the line where you should know these things and you've just tried to rush through, it becomes really exposing. So try and just immerse yourself in it. Enjoy the journey. This is part of it. I know there's a lot of uncertainty when you're applying for different courses and different jobs, but it's everything is going to help you learn. It's all going to be part of your journey one day. And again, easy for me to say at the other end, don't rush. And it was said to me when I was an assistant psychologist and when I was an undergrad. And I thought at the time, like, it's easy for you to say because you're qualified. But now I'm here, I completely appreciate what they were saying. So you're just going to have to trust me. So another thing that you can do now is we're currently running a DCLIN project. It's run by Jake Beasley, who's one of our trainee clinical psychologists, and I supervise this project. The reason I thought I'd bring it to you here is that everybody who takes part, as well as getting a voucher, also is invited to a question and answer session with myself and Jake, where we'll answer any questions about DCLIN, all things DCLIN, in a much smaller group. It's a really nice opportunity to get some more information and have a chat. So if anybody is interested, either drop me your email in the chat, or everyone's got smartphones these days. If you can scan that QR code and fill that form in, we'll contact you again. There's no pressure. It's just going to hear a little bit more information about what it is, what you'll be required to do. It'll take about an hour of your time. And you get a small voucher and an invite to our question and answer session. And I think that's everything from me. I think I've got a bit of time to answer questions.
Okay, thank you so much.